Now to Venezuela, where rescuers have pulled a survivor from a collapsed building 8 days after twin earthquakes struck the north of the country. A 43-year-old security guard had been trapped under rubble in the basement of a shopping center since the 24th of June. Rescuers worked for over 100 hours to free him, braving torrential rain and aftershocks. They kept him alive with food and water while excavating the concrete structure that collapsed around him. He was saved because his cabin held ground and created an air pocket. The back-to-back earthquakes destroyed tens of thousands of buildings and killed more than 2,200 people. Joining us now from the Venezuelan capital, Caracas, is Loyce, the regional director for the Americas at the International Federation of the Red Cross and the Red Crescent Societies. Thank you so much for your time. The rescue of this man after 8 days has captured the world's attention, but from a humanitarian perspective, are we now reaching the point where the focus is shifting from finding survivors to helping survivors?
Yes, I think that's a really excellent way to frame it. Of course, we are thrilled with the miracle of this individual having been saved after a week, and it points to the power of cooperation across our network and our broader humanitarian community. And yet, to your question and to your point, we absolutely need to be focused on those that have survived even before this individual was extracted. And that's what we've been doing as a Red Cross movement alongside the Red Cross of Venezuela, but with many of our other partners here in Caracas to ensure that people have the health services, the psychosocial support, and other really immediate needs like shelter and food and water.
And among those, those essentials that you've just highlighted there, shelter, clean water, food, healthcare, what are the biggest needs right now?
It's so hard to pick one, right? I mean, ask an individual on the street here in Caracas where I am what they need, and they'll say all of the above, and probably things that we haven't even listed. It's important that we, as a Red Cross community, work through our volunteers who are members of these communities, listen to people and what they need, ask them what they need, and this is why we have these community-based assessments from day one, really understanding what the challenges are. But it's on us to actually provide the spectrum of needs for people because people are whole people, right? They don't just need one of those. They need all of those to survive at a basic level, let alone the question of how they rebuild from now.
Venezuela was already struggling with years of economic and infrastructure problems before these earthquakes. We've heard about how that has made things so much more difficult when it comes to having an effective humanitarian response. What have you been experiencing personally?
Personally, honestly, it's been helpful for us to have had such a long tenure here in the country. The Red Cross of Venezuela is 131 years old, actually, and it has lived through generations of leadership here and has successfully worked with just about every government here in Venezuela. So that's been quite helpful. Again, as I mentioned, there are thousands of volunteers across the country who are embedded in these communities, and that helps us understand the complexities, and it's given us, I suppose, some leverage in overcoming some of those challenges. They still very much exist, and yet we are finding ways to ensure that we're able to, for example, bring goods into the country. We just had our second flight come in with a number of supplies that address the range of these needs that I mentioned. And so we'll continue to do that work, to work with authorities in our role as Red Cross leaders to ensure we can break through any barriers that exist.
And looking at the future, how are you preparing for future risks? Because there's growing concern about disease outbreaks and deteriorating living conditions. How quickly can this natural disaster turn into a public health emergency?
This is another great question. As a public health expert myself, I think about this often. It's one of the reasons why health has been at the forefront of this response because, again, the Venezuelans have demanded that and requested that. But that includes water, sanitation, hygiene, and the like. We also want to ensure children are still receiving their vaccinations, adults are still on their meds, and so that's all part of our broader assessment. But we're also worried about things like El Nino season. And I'm not sure to what degree you all have reported on that, but I think the headlines have alerted people that we are in the season of El Nino, which is set to intensify this year. And Venezuela is facing the effect of that. And so you're right, it's absolutely compounded in terms of the risks and the potential crisis. This is why we, as a Red Cross movement and community, really try to anticipate those risks and needs and get ahead of them as much as possible so that we can mitigate the impact.
What is your message to the international community, given what you've highlighted here? Because, I mean, once the cameras move on, there will be very big challenges for Venezuela over the next weeks and months.
Absolutely. I think my main message is that we can do this and we can do this together. And whether it's something like the miraculous excavation of an individual that you all reported on and saw this morning here, or quietly what we're doing to provide that mental health support to ensure people can bathe and cook and live again. Those are the stories that come out of our shared mission and cooperation in this moment. And I think that is what sustains us. It sustains all of my staff here in Venezuela, but it helps the humanitarian community really show up for Venezuelans at this time. And so we really appreciate the global support. We think that once the cameras move on, people should know that we will still be here and we still need them. And so thank you, thank you, thank you from Venezuela to the world for everything that you all are doing to support us here.
Loyce Pace from the International Federation of the Red Cross and the Red Crescent Societies. Thank you so much for your time joining us from Caracas.
Thank you.